All right, good evening, folks. As you're coming on in, welcome. We're gonna get started soon. It's a lot of folks joining us for this evening's webinar. Right. So we're just gonna give it a few more minutes, let people trickle on in before we get started. As we are getting started, a few things to point out to you. If you have any questions or you want to share any comments or resources, please do so in the chat. We are in Zoom webinar mode, so therefore we will not be able to see you. You can see us as the participants or as the panel, but we cannot see you. So you will not have any audio features. So all communication will go through the chat. So feel free to use the chat. And as stated, we will get started here in a few minutes. We're just going to let folks come in and join us. We have a pretty large group that is registered. We're currently at about 155 people here with us now. All right. Greetings, everyone. If you want to say hello to people in the chat, feel free. If you want to let us know where you're currently located, that's cool too. I believe the chat feature should be working. All right, we have a listener joining us on the phone. Greetings to that listener. Okay. And again, we are in Zoom webinar mode. For the folks who are just now joining us. All right. More people are trickling on in. We're at about 171 people are with us at the moment.
Brandon, I just got a note from someone saying the chat is disabled.
It's not working? Okay. I'll work on that in the background as we get started.
Thank you.
Yep. Okay. Thank you for letting me know. All right, folks, we'll get started. Greetings. Welcome to What is Medical Traumatic Stress? Preventing, Recognizing, and Coping. And our featured speakers will be Dr. Meghan Marsac, Brandon Jones, myself, and Jen Aspengren. And before we get started, I want to just do a little bit of reminders for you. We are in Zoom webinar mode. The chat feature should be working here in a moment. We're going to work on that in the background. So if you have questions, if you want to share resources or information, feel free to do so in the chat. We'll get that up and rolling here in a moment. We are also to let you know, since we're in Zoom webinar mode, you will not have a microphone option. So all information should go into the chat for sharing. We are recording today. And if you registered for this, you will receive a recording and a handout of the information that will be shared today. And with that, I'm going to get started. So I'm going to tell you a little bit about MACMA first. And MACMA is the acronym for Minnesota Association for Children's Mental Health. I am the executive director of MACMA. We lead with compassion, knowledge, and support. We were founded in 1989, and we are a 501c3 nonprofit whose mission is to promote positive mental health for all infants, children, adolescents, and their families. We provide education and resources to professionals, families, and youth throughout the state of Minnesota and beyond. A little bit about myself. Again, I'm the executive director here at MACMA. I've been the executive director since 2001. I also am a professor, teach grad school at 2 schools here in the state of Minnesota, at Metro State, and I teach at Citrus College. I also do some consulting work from time to time, and I used to be a therapist. I no longer practice clinically anymore, but all my work is still therapeutic. For those of you who care about educational background, I have a bachelor's in sociology from the University of Minnesota, have a master's in community psychology from Metro State, and another master's in psychotherapy from Adler Graduate School. And also, if you're from Minnesota, this is a bigger deal. If you're not from here, you're probably like, what is the Bush Foundation? But I am also a 2013 Bush Leadership Fellow. And with that work, I focus specifically on social and emotional intelligent skill development amongst African American adolescents. And my role today is to share some of the things that my organization is seeing, some of the things that we're seeing trending, and also share some information from a report because it lines up very well with how our organization has responded to the needs and the demands of communities all throughout the state of Minnesota. And that report is from the Center for Disease Control. Some of you may be familiar with this. It's kind of hot off the presses. It just was released a few weeks ago. And this is the Youth Risk Behavior Survey. And what the Youth Risk Behavior Survey has done is it's collected information over the last 10 years and from 2011 to 2021. And it's really highlighting what kind of trends are we seeing and what kind of things are going on with young people. Here are some of the main focal areas from that report. They looked at sexual behavior, they looked at substance use, they looked at young people who are experiencing violence, and violence was it included community violence, domestic violence, bullying, so a wide array of violence. Looked at mental health and suicidality, and then it looked at some new emerging issues and concerns with young people, and those concerns included school connectedness, parent monitoring, and unstable housing. And unfortunately, we know in the work that we do that a lot of the concern, especially as we are continuing to move through the pandemic, and some of us feel like we're done with the pandemic, those concerns have been highlighted even more due to some of the stressors from just dealing with the pandemic and the socialization of our young people and adults and how we're adjusting to this new normal that we're currently in. Here are some of the key findings, and I want to just share these with you quick that you have a good understanding of what was in this report. And I would encourage you all to download this. It's free for you to download if you just Google the report. So here's one. Here are a few of the key findings. So one was, unfortunately, almost all the indicators of health and well-being in this report included protective sexual behaviors, so using things like condoms, sexual transmitted diseases, STDs, testing, and HIV testing, experience of violence, mental health, suicidal thoughts and behaviors, and worsening significance. As we saw in the 10-year period prior to the COVID-19 pandemic, mental health among students overall continued to worsen, with more than 40% of high school students feeling so sad or hopeless that they could not engage in their regular activities for at least the last 2 weeks during the previous year. A possible indication of this experience of depressive symptoms, we also saw significant increases in the percentage of youth who seriously considered suicide, made a suicidal plan, and or attempted a suicide. So this report did have a lot of focus and information on suicidality because we've seen increasing numbers in many different pockets of young people, many different demographics of young people across the nation. Couple more things from here. Some more of the key findings across almost all measures of substance use, experience of violence, mental health, and suicidal thoughts and behaviors. Female students are faring more poorly than male students. These differences and the rates at which female students are reported such negative experiences are stark. And then also they found out from this report that school connectedness, defined in the report as feeling close to a person at school, has a long-lasting protective impact for adolescents well into adulthood on almost all behaviors and experiences included in this report. In 2021, female students, students of color, LGBTQ plus youth, and students who have had any same-sex partners were least likely to feel connected at school, indicating less protection for those groups. So these are the things that we are addressing in our organization. We're connecting with professionals, with families, with young people to the best of our ability to address these things and other things that pop up. But these are the things that we're seeing across the nation, are some of the bigger concerns that young people are dealing with. So how do we do this at our organization, MACMA? Well, we do it through our family support programs. We have family coaching. We have tons of resources. If you go to our website, you will find things that you can download, quick things. You can find information. You can get access to different places and activities and things that can help with mental well-being and emotional well-being. So we do that through our family support programs. We also do it through our art programming. And our art programming, the highlight of our art programming is what we call fidgety fairy tales, which are mental health musicals. So what we do is we take classic childhood stories and we add mental health themes to them, and then young people get to perform them in theater. We rewrite songs, we come up with costumes, we perform these at schools, at parks, at churches, wherever people want to kind of see our fidgety fairy tales. We bring it to them and we engage in a nice 45-minute musical that people can have stories that they're familiar with and learn a little bit about mental health that kind of destigmatizes it and makes it easier to digest. We also have had several anti-bullying campaigns that we've done over the years as well. We also have youth engagement programming. Our youth move is our main program, and what we are attempting to do with that program is to mobilize young leaders, ages 12 to 22, and figure out what's their perspective, what's their level of advocacy, what's their level of understanding when it comes to mental health and the world that they live in. And one of the ways that we've done that is through our Youth Voices Experience magazine, which is a digital magazine where youth submit all different type of art, whether they submit songs, sometimes they submit drawings or paintings, things of that nature, and we publish it in a digital magazine for them to share and express their voices, and for folks to understand the youth's voice on what's currently going on in mental health. Then we have our professional education. We do conferences. We have two major conferences every year. One we're gearing up for here at the end of April, which is what we call our MACMA Spring Conference. And then we also have our Infant and Early Childhood Conference every November. We do trainings, though, all throughout the year. Most of them are virtual, like the one that you're joining today. And we have tons of publications and resources again on our website. We have a toolkit for our IAC guide, and we're working on other toolkits and manuals and easily to digest content for people to share, people to post on social media, and for us to increase the mental health awareness and the concerns and also tips that people need to deal with mental health. And I mentioned our conference this year is April 23rd through April 25th in Duluth, Minnesota. If any of you would like to join us or you know somebody that you'd like to share this with, please go to our website for more information. We are expecting over 1,600 participants. We have over 85 workshops. And if you're someone who needs continuing education credits, we have about 18 of those, up to 18 of those over that 3-day period. So we are looking to have a good time in Duluth and have a great learning experience and a networking experience there. And then a few more things that we do as I close out and pass it on to one of my colleagues is our infant and early childhood professional development that we do. We have continuing education credits there. We have our endorsement process, which is our nationally recognized career development pathway that honors professionals who are interested in education, experience, and skills in working in infant and early childhood. We have membership as well, where we support those folks to make sure that they have a professional home. And then we also have something called reflective of consultation that is an extra layer of support to make sure that not only are they in the best possible shape to do this work, but they're also learning from their peers. They get the support that they need, and they also have updated skills and tools to continue to do this awesome work. And then lastly, I just wanted to remind you all that healing is a journey. You know, we all go through things, we all have challenges, but we want to make sure that the challenges that we go through, that you have somewhere to go to get some information and that you're not alone on your journey. We're all going through our journeys, but sometimes it may be just someone we run into that is a facilitator on our journey that can just give us a jewel, a nugget, a little piece of information that helps us keep moving forward to the best of our ability. Again, I'm Brandon Jones. I look forward to the rest of what we have to share with you all today, and I'm going to pass it on. Thank you.
Thanks so much, Brandon. I'm Jen Aspengren, and I'm the CEO of Alongside Network, which I'll talk a little bit more about, but wanted to start by sharing a little bit about my story and how I got into this work. Um, One sec. When my youngest son was 7 months old, he had a congenital airway defect that meant that he was having trouble breathing as he was growing. He had a major surgery that saved his life and also meant that we were in the hospital for an extended period. He was intubated and sedated for a long time. And essentially, when we brought him home, he was a different kid than we had brought to the hospital. So we brought him home and he basically scream cried for like 9 months straight. We kept bringing him back to the surgeon, bringing him back to the pediatrician, back to the emergency department in the middle of the night, asking everyone, did you leave something sharp in this baby? He is so sad. And everyone kept telling us, he looks great. He's doing great. This is exactly what we would expect. And we could tell that that was not the case. And there was some sort of disconnect that we were really struggling to figure out what was happening. Um, and my background is 20 years of working in systems change work in nonprofits with social entrepreneurs. And so continue to sort of think about, is this a gap in care, or did we sort of fall through the cracks? We eventually had a conversation with his pediatrician where she said, I wonder if this is like a post-traumatic stress reaction. And she was right. She also didn't know what to do with a family presenting in her office with this question. So it took us until my son was 7 years old until we were able to find the right resources and support for him. And throughout that time, just continued to think about sort of the health equity implications of this. We're a white resource family with a big network we're also happy to go toe to toe with doctors. And if we weren't finding answers, what did this look like for other families, for example, who were navigating not in their first language or who were experiencing racism within the healthcare system? So I worked on this question and tried to understand what is the research and sort of what do we know already, sort of nights and weekends, and it became something I felt very passionate about. And Meghan Marsac will talk more about this, but what we know is there's 20 years of research around this question, making it very clear that pediatric medical traumatic stress is a huge problem for a lot of families. And then essentially there are amazing pockets of solutions that are happening around the country and around the world. And so formed Alongside Network to really begin to consolidate a lot of those solutions that are happening and be able to do some of that direct work with families, bringing those solutions right to families, and then really building a network of families so that families are the ones able to drive a larger systemic change going forward. So we do work on two separate levels. One is working directly with families. We have family well-being groups, which meet. We use a curriculum out of Australia called Take a Breath. It's a 7-week curriculum where we meet online with families once a week with each cohort. And we pair a lived experience facilitator with a clinical facilitator and walk folks through a curriculum, really focusing on validation of their experience, connection to other families, and also increasing coping skills. And then our goal is really to mobilize the families that we work with to build a larger network and sort of increase demand for larger solutions around this question so that this work can be integrated more thoroughly into the hospital setting. And then our aim is really to create a system where we think about psychosocial supports as being sort of as ubiquitous as cardiac rehab after a heart attack. We know that the outcomes are better. We know that the demand is there, and we just need to build the system so that families are having that experience. So just welcome you to look at our website and learn a little bit more about our work before I turn it over to Dr. Meghan Marsac. And just want to, again, thank MACMA and Brandon Jones for partnering with us on this, and Dr. Meghan Marsac for bringing so much fantastic content to tonight's conversation. Let's see. Just going to quickly read a little bio about Dr. Marsac. Dr. Meghan Marsac is a pediatric psychologist and a tenured associate professor at the University of Kentucky and Kentucky Children's Hospital. Dr. Marsac also serves as the associate director for the Center for Pediatric Traumatic Stress. Dr. Marsac specializes in implementing evidence-based strategies to promote adjustment to medical conditions in children and families. She's a leader in the field of pediatric medical trauma, having published over 70 academic articles, 10 chapters, numerous blogs in Psychology Today, and a groundbreaking book for parents to use to help support their children through medical care, as well as to care for themselves. The book is called Afraid of the Doctor: Every Parent's Guide to Preventing and Managing Medical Trauma. She's also the CEO of the Selly Coping Company, a company with a mission of making medical care better for children with medical conditions and their families. So, Dr. Marsac, I'll pass it to you. Thank you all for attending.
So just get myself unmuted here. Thank you so much for having me. I'm so excited to be here with Jen and Brandon to talk about something that is a very important topic, I think, in our community that's often not talked about, and things that, medical traumatic stress isn't a well-known topic in our healthcare system still. So just a couple of disclosures right up front here. I am a co-author of Afraid of the Doctor, which is a book that I might reference throughout today that has some tips for parents on how to recognize and manage medical trauma, which is exactly what we're going to be talking about today. Also, as Jen said, I'm a co-inventor of the Selly Coping Kit. So just to put some disclosures up there as well as we move along. So a little bit about me. I am a pediatric psychologist now. I got a little excited and moved along there. I did my undergraduate training at a small college called Baldwin Wallace University in Northwestern Ohio. And then I did my graduate training at University of Toledo, where I specialized in clinical psychology and got my PhD there. From there, I ventured over to the Children's Hospital of Philadelphia to finish out my training. I did an internship fellowship, and then I took a position there, my early career there. And that's where I really kind of started to really dive into the medical traumatic stress world. I had some patients that I worked with at the Children's Hospital of Philadelphia that really inspired me to do this work that hopefully we'll have some time to share about a little bit today. And then from there, I came over to the University of Kentucky Healthcare, and that is where I currently sit, with a goal of really increasing access to mental health services for our kids and families who are managing medical conditions. So I think when we talk about medical traumatic stress, it can be really helpful to think about and talk about your own experiences. So thinking about your own family or families that you serve, if you're in a role where you're taking care of families with medical traumatic stress, and thinking about kind of those moments that were challenging throughout your journey as we talk through the different parts about medical traumatic stress today. So I think actually Brendan already kind of set us up for this, is thinking about our own journeys in life. And that's certainly true when we're on a medical journey. I think one of the things that parents and families have shared with me over time that can be super challenging is all the twists and turns and the unknowns and the wait, back up. Oh, we thought we were doing this. Now we got to go do this. And how our medical life can really kind of interrupt and get kind of laced into our kind of real life and the rest of our life. It can really interfere with the other objectives that we have. So as you think about navigating your medical care for your child or for patients that you serve, really thinking about where are you at in your journey now and kind of what's up and coming, and thinking about a little bit about maybe what you left behind and kind of where that might put you right now. So thinking a little bit about what is the challenges and what is tough about medical care. So we've done lots of research over the years to learn from families and to really hear from our families' voices. What are the things that are really tough for parents? What are the things that are really tough for kids? So things like medical procedures. I think for kids, needle sticks can be particularly challenging. And I think, for parents, some parents were like, oh, it's just, we don't want our kids to get needle sticks, but that's often not the scariest part of medical journey. So we have some differences maybe between what our kids find challenging and then kind of what is challenging to us. The missing out of events. And so sometimes it can also be a little bit challenging when you have a really tough medical journey and you think you're going to be able to do something. Like we've had kids that they think they're going to be able to play in this sports season, or they're working really hard and doing all their treatment exactly like they're supposed to. And then something changes and they end up missing a school dance or missing a birthday party or all those different things. There's other challenges about some of our kids really struggle with taking medications for all different kinds of reasons. Sometimes taste, sometimes they're trying to exercise some control over part of their medical journey. Sometimes things are painful. Sometimes they don't make them feel good. So there's lots of challenges around medications. That unpredictability that I spoke about just a few minutes ago. One thing that can be really hard from a parent's end and a caregiver's end is dealing with your child's fear or anger responses, and dealing with anxiety and trauma responses in your child. Sometimes as parents or caregivers, we have our own kind of emotional energy that we're walking through the door with as well. And we're trying to manage ourselves, and we're trying to stay strong for ourselves, for our kids, or stay strong for our family. And then, you might have a collision with your child that day that you just don't have it in you anymore. An anger outburst comes or an anxiety attack comes. So trying to manage those emotional reactions. Siblings reactions too can be really challenging for folks. I know, so for some families, their caregivers are really required to spend a lot of time with the child that has an illness, and then the sibling without the illness is kind of left to navigate things on their own sometimes, or with other family members, and that can be really hard on families sometimes too. Other things, I love and hate this picture. I always put it up here because I think about, even from an adult's perspective, if that's kind of the picture of the medical team coming at you and coming towards you, and you don't know what's going to happen, how scary that could be. So just that nature of the medical care in itself, I think as adults as well, like, we want to know what to expect. So making sure, our kids don't know what to expect. And sometimes even when they do, I think that can be really scary. I think that's been even harder since COVID, because all of the healthcare providers are required to have, like, kind of gown up more, put more protective equipment on. Sometimes we don't get to see our healthcare caregivers, our healthcare professionals' faces. We don't get to engage with their expressions as much. So that can be really challenging. For some of our families, we have a lot of long hospitalizations or overnights in the hospital that can be tough to manage. We know that in our country, in our setup, healthcare often comes with financial needs and costs. For some families, navigating medical care means less ability for people to work, or to be primary earners might have to change. Sometimes the medical bills are really tight, like, can be really a lot to manage. So we know, our families are often walking around with financial pressures. For kids, school can be protective and wonderful and a great escape. It can also be really challenging and stressful. Thinking about if they're struggling with school, or some of our kids who miss a lot of school and then are trying to stay caught up in the pressure that is on kids. That also is a lot of pressure on parents who are trying to, keep their child caught up in school. And I don't know, for any of you out there what ages your kids are, but some of the things that they're learning even in elementary school, if you as a parent are trying to support that, like, I don't understand how they're teaching math these days. Like, I took math, I did okay with math, but like, trying to support even elementary school age kids with their projects can be really hard. So adding that extra pressure on parents as well as on kids is awesome. For some of you, you might have had some really tough or negative experiences. Some kids might associate every medical appointment with something painful or something scary. So kind of thinking about that as well. So talking about, this talk really is focusing around what is medical traumatic stress? What does that look like? And how do we define it here? So kind of the big, fancier, more official definition was can be described as a set of psychological and physiological responses in kids and their families to both, like, the medical condition and treatment related to the medical condition. And so that includes things like body responses. So sometimes if you walk into the hospital where your child had a scary diagnosis or procedure, heart starts racing. And see that in kids, we see that in parents, we see that in siblings. It can include, like, that anxiety, the circling of your mind and those things. So it can include both kind of body responses and emotional responses. How I like to describe it in a more simplistic way is it's our emotional reactions to scary medical stuff, kind of whatever that might be, and however it comes out can be a part of medical traumatic stress. So there's a lot of different terms that people use to refer to medical traumatic stress. And I think one that can often be helpful if you have not really heard of medical traumatic stress before is just PTSD. So it's really PTSD symptoms, just like, veterans get from war, related to your medical care. And we'll talk a little bit about how that plays out in not just kids, but also family members as well. There's some other terms up there that you can take a look at. So if you're Googling around learning more, all these different terms, some have some overlapping meaning around medical traumatic stress. Now, who is more likely to develop medical trauma symptoms? So before we start kind of diving into the slide, I just want to say that any child, any family member, parents, siblings, anybody who's affected by a medical condition, it doesn't have to be a chronic one. It doesn't have to be something that like seems really severe. For some of our kids, they might, break their arm or break their leg and go to the hospital and need treatment. And it was really scary for them. And they can come out with medical traumatic stress symptoms. Some kids even have like really extreme reactions to vaccinations and whatnot, and had some really bad experiences that way, and they can come out with medical traumatic stress. Some factors that we know from the research that make it more likely to experience medical trauma over time and to have it persist over time are feeling afraid that you are going to lose your life. So even if the event isn't objectively, so if we take all the data and be like, no, of course you weren't going to lose your life in that situation, your child was going to be okay. If it felt like at that time that you had worries about your child's life, or your child had worries about their own life, that makes us more likely to have trauma symptoms. For those kids that have less support, and so, if you want to flip that on the other side, kids that have more support, that's a protective factor for them. So if you are a parent that is logged onto this call looking about how to support your child, being there, being in your child's corner, that's a protective factor. Kids that don't have somebody to lean on and go to are at more risk. There's certain kinds of coping, and we'll talk a little bit more about what we can do to kind of promote positive adaptation to medical events, but something called avoidance. So if your child, or if you are somebody who just doesn't want to think about it, something hard or bad is happening, you just push it out of your mind, push it out of your mind, pushing out of your mind. We know that when with people that have that tendency to kind of push it out of their mind, that leads to later development of trauma symptoms, a higher risk of later developing trauma symptoms. Other life traumas. So if you have been in a life situation in which you've had a lot of other stuff that's been really hard and traumatic in your life, and then you add a child's medical condition on top of that, and for kids that if they've had other things in their life, like if they've had abuse, or they've had a fire in their home or a car accident, and then they get sick, each one of those kind of additional experiences puts them at higher risk for developing medical traumatic stress symptoms. For our kids that have other emotional health challenges, that is also a risk factor. So if entering medical care, or for some people I know there's genetic conditions too. If you have other things, other anxiety, depression, or kind of other things where you struggle with emotional health, that puts your child at higher risk for trauma symptoms. And then also birth assigned at sex. Currently, females are at higher risk for reporting more significant medical trauma over time. So thinking about how common is it? How likely is this to happen? So there's some really variable ranges over time, but a really good estimate that's kind of held steady over time is approximately 30% of kids with illness or injuries and their parents develop trauma reactions. And so that's, about 1 in 3. So if you're in the waiting room, waiting for your child to get treatment, and you look around and you pick out randomly, 1 out of every 3 people that's likely to have medical trauma. So it's really, really common. We have millions of children and millions of families that are currently experiencing these symptoms right now. Longer term, so for some of our medical conditions, there's a period of treatment, and then the treatment, ends, and then people recover in that way. So in those situations, anywhere from 10 to 75% of children, kind of depending on a number of factors, will persist and have some challenges over time with their emotional health. And kind of 0 to 22% of our parents, I would say the 0 is the unlikely end of that schedule. But, thinking about, that's quite a few that we want to kind of intervene and support as well. If you want to take a quick look at this graphic right here, this breaks it out a little bit by what kind of diagnosis, and it also shows like parent to child. And one of the things you might notice on here, for a lot of the conditions, not every single one, but many of them, we see higher rates of trauma symptoms in parents than we do for kids. So what does this look like, and what might we see if we're trying to keep an eye out for medical traumatic stress in our kids? Things like changes in their overall mood. So if you have a really bubbly, happy kid that's, generally excited and bouncing down the hall and pretty happy. And then all of a sudden you're seeing them kind of withdraw, want to spend more time in their room. If they seem like they're worrying a lot more, they're feeling more sad. Another one that sometimes gets mistaken for other things is sometimes our kids become more angry and irritable as a trauma reaction. And a lot of times, that's a little harder for people to have patience with because you see your child acting out. And we're like, gosh, what's going on with them? But sometimes that can also be a sign of a trauma symptom. Some of the other kind of classic traumatic stress symptoms are re-experiencing. So that's kind of with it, like kind of repeating in your mind. And so in kids, we'll see that sometimes in the form of bad dreams. Sometimes we'll see it in their play, like they might reenact part of their medical care kind of over and over again. Sometimes we'll see it in their artwork where they're going to draw things out. For some of our kids, like it'll circle in their minds over and over again. Some of our kids will talk nonstop over and over again about their experience. Kind of on the other end of the spectrum, sometimes we have what we kind of mentioned before. We talked a little bit about avoidance. Kids that tend that other direction. Sometimes for our kids that are in the hospital a lot, they'll hide under the covers whenever the doctors will come in. They'll say, don't talk about it. I don't want to hear you talking about it. I don't want you, don't talk about it in front of me. They want all the communication just to go to from the medical team, just to the doctors. Sometimes these kids might put a battle on before getting in the car to come to an appointment. So they're really trying to avoid, they do not want that treatment. They do not want to deal with their medical condition and will fight you on their treatments. That can be a sign of avoidance sometimes. The other kind of category that we take a look at is something called hyperarousal. So that's like your fight, flight, freeze response. So where your body gets hyperactivated as if there's a threat coming at you. So one of the ways that I often explain this is, if you're out in the woods, you see a bear, your body's going to get ready. It's going to either like get ready to fight that bear off. So everything's pumping in your body. You might start breathing harder. You might start sweating. You're getting ready to do a fight. Same thing if you're going to run away, or you might freeze in place. And again, you have like kind of those body symptoms. This one also can be really hard if you have a kid that's like entering particularly a medical treatment or a situation where you need them to comply with something so that they can get their treatment. And then they get this like fight or flight mode where they, I've seen kids like screaming at nurses, saying things like, oh, you're trying to kill me. You're trying to, this is all your fault, and then they get their kind of medication, get it done, and then they're fine again. And parents have shared with me, like, that's not my child. I'm like, yeah, no, I believe that. That makes a lot of sense. And it's a trauma reaction sometimes. So that's kind of another cluster for what it might look like in kids. Similar things, you can see similar kinds of symptoms in siblings and probably in different environments. For siblings, sometimes places could be triggers like the hospital settings. There might be other places that would bring this out in siblings related to their brothers or sisters' care. For example, for some siblings, if they know their brother or sister has an appointment the next day, they might kind of get stuck or worried about it. They might have trouble thinking and focusing at school or those kinds of things. Other things just to keep an eye out for. So we know in kids, sometimes the trauma symptoms or mental health symptoms aren't real obvious as mental health symptoms. Sometimes they can show up in other ways. So if you're seeing changes in appetite that don't seem to make sense, like with their medical care or different for your kids, if you're seeing sleep difficulties, that's a new or different change for your child. Other things like increased irritability, if they're like a lot snappier, less patient, if they're withdrawing or isolating themselves. This one can be really tricky to figure out with teenagers because some teenagers do withdraw, and sometimes they're like, I've also worked with some young kids that have shared with me like, no, I'm not like upset withdrawing. I just need a break. I need some space. Mom asks me how I'm doing over and over again. I want to go to my room and chill. So it doesn't always mean this is medical traumatic stress. Sometimes there's other reasons that kids are doing these things. Anger or frustration outbursts, those tantrums, the screaming, keep it, if that's different for your child and you're like, gosh, what's going on with them? That's something to kind of keep in mind. Increased worries. For some of our kids, especially some of our younger kids, but even some of our teenagers start to have challenges separating where they want to like always be with a parent or a caregiver or family member or somebody they've kind of connected to. Any kind of self-harm thoughts or actions, we always say immediately ask your doc. If you don't feel like you can keep your child safe, take them to the emergency room right immediately or call 911. We don't take those lightly. So just ensure that if your child is starting to have self-harm thoughts or actions, that you address that right away to get some support for your child. Let's talk about what this looks like a little bit in caregivers. There's definitely some overlapping in our caregivers, some changes in overall mood. So one of the things that stands out that can be a little bit different in caregivers is a lot of our caregivers or parents struggle with guilt, feeling like they should have picked up on their child's medical condition earlier. Sometimes moms who have carried their babies and birthed their babies feel like they did something wrong in the pregnancy. Sometimes they feel like, oh, maybe I shouldn't have fed him this kind of food. All kinds of guilt reactions. A lot of our caregivers have expressed, oh, if I could just trade places with my child, I'd do it in a second. So some of those kind of those things are a little bit often that kind of stands out. Re-experiencing, again, for our caregivers, racing thoughts, kind of replaying conversations. We've had a lot of caregivers share that, like, when they first found out about their child's medical condition, like they have the whole scene memorized. It really sent in. Kind of replaying regrets over and over again. Maybe I should have gone to this doctor or this hospital. Maybe I should have done this. Maybe I should have done this. Kind of that, kind of getting stuck in things. Avoidance. So things, we also have parents sometimes where you're like, you see that doc coming, you're like, I just can't have this conversation today. And you like turn and go the other way. Sometimes parents will start forgetting appointments, and maybe not even on purpose. You're just like, you've got so much going on, and it's kind of your body is just like, I can't keep all this straight, and start forgetting it, trying to avoid talking about it. One thing to keep in mind, if you're in a partnered relationship, or if you have other family members that are helping you and your child, if you've got somebody that's having trauma symptoms that are avoidant and somebody that's having trauma symptoms that are re-experiencing, that can cause a lot of family conflict as well, because you might have one person that's replaying, want to talk about it constantly, and it's going on, and they can't get it out of their head. And then you have another person that avoiding, doesn't want to talk about it, doesn't want to think about it, doesn't want to deal with it. So if that's something that's going on in your family, kind of keep in mind, there's a chance that both people might be having different types of trauma symptoms related to the child's medical care, and kind of think about how you could get support to work through that. So we also have hyperarousal in parents. I know a lot of parents have shared with me that this really hits them, and there's sometimes certain hospital rooms or certain roads. I've had some caregivers share with me, they don't take the route past a certain medical building. They'll drive completely a different way around because they start to get panicky when they get close. So just kind of keeping in mind that this is not just about kids, it can also be about caregivers too. And we got to take care of caregivers as well. So thinking about what brings those symptoms on. So one thing that can be really helpful to recognize, either for your child or yourself, or what are the things that make it more likely for your child to start struggling with their emotions? For some people, it can be a time of year. Maybe your child had a diagnosis in a certain month or a certain time of year, and that's gotten associated somewhere in your body. Sometimes it can be certain people. And so sometimes even if you see a medical provider who's treating your child outside of the setting, and even if that provider saved your child's life, sometimes that will bring back some real intense emotions just by walking into them. Sometimes there's certain smells that trigger things. I know some people like that. There's a certain smell of a hospital that they're just can't, nope, can't. Different sounds will be triggers for different people. Sometimes you'll hear a certain song. Maybe you heard it on the way to the hospital, or it was one you listened to a bunch during a certain time. So just thinking about what are the things that are associated for you, for your family. Are there certain medical procedures that are going to be harder for your child? Are there diagnostic tests that are going to be harder for you? Kind of thinking about what are the things that kind of set you up to be in a more sensitive place. The other thing I'll just share too is I've had a number of parents over time share with me when we've talked about what does medical traumatic stress look like in caregivers. Stop and say, I thought I was the only one. I thought I was going crazy. And I think one of the things that we really hope to do by having these kinds of sessions and opening up this information is to stop that. No, you're not going crazy. And let's talk about it. Let's open up the conversation so that everybody can get support with this, both from a caregiver and a patient perspective too. So here's some other things to keep in mind too. So if you're trying to sort out where things are coming from or what's going on, things that can happen that can kind of mimic trauma symptoms sometimes. Sometimes you can have both pieces of things, or sometimes other things might account for behaviors or changes or things you see in your child. So things like pain. We know uncontrolled pain can result in trauma symptoms over time, but you also know that sometimes uncontrolled pain looks like trauma symptoms in children's behaviors, especially when you're trying to sort it out in kids that are nonverbal or kids that are younger. Can be really tricky. Things like oppositional behavior. So is your child having a traumatic reaction, fighting about something or saying, I'm not going to get that blood work done. You can't make me. Is it because of trauma and they're having or an anxiety reaction, or are they just being oppositional and like, nope, I'm not doing that today. I'm not cooperating with you. Is it a control thing? So kind of sorting that out can help figure out how can we best help your child through things. Things like ADHD can mimic trauma symptoms too, depression, anxiety, and sometimes disease-related symptoms too. So one thing that I think as a psychologist that I always appreciate is I always want to be working closely with the child's medical team so that if we see new symptoms in a child, that we can run it by the medical team as well to ensure that we're not going to assign an emotional health reason for something if there's a physical health change in a child. So something to kind of keep in mind as you work to advocate for your child. So I always like to take a breath there because I think that's a lot to take in. It's a lot of, oh my goodness, everyone's traumatized. How are we going to manage? But really thinking about trauma creates this change that you don't choose, but you get to heal and you get to choose to create that change and heal for yourself. If you're affected, help your child heal. If your child's affected, help sibling heal from kind of the trauma exposures and whatnot. And so this is where you can try to start to take some control over, what your family's experience is. So one thing I do want to point out to you in here, so we talked about medical traumatic stress and what that looks like, but there's also something that's gotten more and more research in recent years called post-traumatic growth. And basically what this is saying is once you've gone through some traumatic events, such as some of the traumas with medical, that some people, in addition to possibly having symptoms, are able to take that and make meaning out of their experience and take it to kind of fuel them to want to do better for the world or to engage in something that's going to be really positive. So kind of wrap some meaning around it and then kind of grow from the experience. So even though I also like to say this to parents too, because sometimes we cannot control the medical trauma that our child might experience. We can't control their medical conditions often, but what we can do is promote their ability to adapt and their ability to grow and to have some growth out of this experience as well. So just a quick moment to think about as a caregiver, kind of where does your role sit? So I imagine many of you are caregivers out here. And if you're not, if you're on a medical team, think about the caregivers that you work with. And so thinking about one thing that happens to many of our caregivers is they can lose their identity into their child's medical condition. So as you're thinking through where are you at in your journey, where's your child at on their journey, where's your family at on their journey, making sure that you are taking care of yourself a little bit. We'll talk about this a little bit later too, but taking the time to remember you are a person first and you have needs too that need to be taken care of so that you can remain healthy and care for your family as well. But bringing all these pieces together. We also like to highlight, and I think for some parents, this feels really empowering, and for others, it feels really scary, that you really can be the leader of your child's medical team. Sometimes you're forced to be the leader of your child's medical team, even if you don't want to be. You know your child best, you know what to look for, and you know when things are shifting, and you know your child's kind of symptoms and your challenges. And so you know the picture of your child better than anybody else. So you really get to be their coach, get to be their parent, get to be their caregiver, and get to be the leader of their team. So talking about some strategies of what can we do as we're trying to navigate medical care for our child. So I wrote a book that I talked about a little bit earlier called Afraid of the Doctor. And my co-author for that book is Melissa Hogan. She's a child with a rare disease. And so she really brought her ideas into this book around what is it like to walk this path as a parent. We kind of combine that with what I've learned over time as an expert in pediatric medical traumatic stress. And one of the things that we came up with is thinking about, as a coach, kind of how can you approach different situations for your child? So thinking through collecting information. So if you think about, okay, what is my child struggling with? Let's say it's needle sticks. So sitting and thinking through, what are did needle sticks ever go well? What can the medical team, what options do we have to try things differently? Does my child respond to any rewards? What makes it worse? Is there anything that makes it better? Do we need outside help? Do we need to go and get a psychologist or mental health provider to walk us through this? What are the resources available in my community? So kind of getting that information together, trying to try some things, observing the situation, observing how your child reacts, asking a lot of questions, asking questions of your medical team, asking for support, picking out what do you think the strategies are that work with your family. When I get the opportunity to partner with families, I always want to engage families in that. So again, really thinking about, your child best. What do you think is going to work? Can you partner with somebody to try to make a plan that is most likely to help your family? And then helping your child through the let's say in this instance, needle stick procedure, and then starting over again. Be like, oh, that didn't work. Let's collect more information. That worked or was a little bit better. What do we need to adjust? So kind of thinking about this in a systematic way can be helpful. Some other strategies, I'm going to give you examples of how to deploy a few of these. All of these are detailed out in short chapters in this book, in the Afraid of the Doctor book. But thinking about what are the things that you can do as a parent that might help either prevent medical traumatic stress symptoms from occurring in your child, or to maybe decrease some of the stress that they're having. So thinking a little bit about the timing, sometimes we have no control over the timing of medical procedures, appointments, and whatnot, but sometimes we do. And so thinking about for your child, there's a number of different parts to this, but one of the things that you can consider is for your child, do they do better in the morning? Do they do better in the afternoon? What is your work schedule? When are you going to be more rushed? What's your child's school schedule? Are there certain things that your child doesn't want to miss versus are there things that, won't be as hard to miss? Is there a special family event? And looking to think about, and talking with the medical team, where do we have flexibility versus where is there no flexibility? We all know, as I navigate the medical system myself, sometimes you have to take the appointment because it's the only one they got. But there's other times where there might be some flexibility in it that we might be able to work it to make it better for your family. Sometimes medical play can be helpful for kids. And so there are some specialists that work with medical play kind of more formally. So sometimes child life specialists, if your hospital or your doctor's office have access to a child life specialist, that can be really helpful if your child's having anxiety about their medical care or trauma about their medical care. Sometimes psychologists do some medical play too. Sometimes social workers will also integrate that into their care, but you can do some at home. And so one of the things that can help you feel more comfortable at home or help your child be more comfortable is to just get some of the supplies that they're exposed to and let them do free play. Let them, dress up their doctor and dress up their bear or their stuffed dog as a doctor, do medical treatments on their animals, do medical treatments on you. One of the things that this can also really help with is if you engage in this with your child, is you can come up with a common language. So some of our kids, we might use the word stethoscope, they might use the word listener, or sometimes for like needle sticks, some kids call it poke, some kids call it sticks, some kids call it, all kinds of different things. So figuring out for your child and your family, if you're going to work to communicate around this, what kind of language works the best? Other things that can be helpful. Now, this can be helpful for kids, but this can be particularly helpful for kids that have limited verbal abilities or have nonverbal communication strategies. You can create visual schedules to help your child walk through the appointment. So if there's some appointments or procedures that kind of what that pattern would be, you can have them create visual schedules. You could also have them create social stories where they make a book about like what's the experience in the medical office. We've done this with a number of our kids here, and we've been able to actually take some pictures and have a stuffed animal for the kid, and the children then take their animals through the appointment, and then we make a story that parents and kids can read together at home. You can make stories that are really specific, like this is my needle stick story. this is my story about my breathing treatments. Or you can make them more about like a general medical appointment. Like first we go in the parking garage. You can take a picture of the doctor's office from the outside. You can take about a picture in the parking garage. You can take a picture in the parking lot, and just make it really specific that it's like, this is what to expect when you walk through the hospital door or for your appointments. I think one thing that this can also really help with, if there is a nurse or a doctor or a social worker or child life specialist in your treatment facility, or even a pediatrician that your child's going to see, if you can share this with them and say, hey, can we follow this pattern? Like, does this work for your team? Because then you can bring the medical team and get them on board with the strategy and have them follow the same patterns as what you're mimicking and practicing at home. Some other strategies that can be really helpful. Distraction can be a great strategy in the short term. The one thing we have to be a little bit careful about with distraction is that long term, you don't want to just distract every time there's a negative emotion, because we do want to try to deal with and work through some of the negative emotions. But distraction is great for things when you have like short-term procedures that you need to work through. Really thinking about what works for your child, planning ahead. Another thing to think about if you're going to use a distraction strategy is to ensure that you're refraining from overstimulating. I don't know if you've ever had an experience where you're in an appointment or in a doctor's room and you have like one person come and try to distract a child, and then it's not working. The child starts crying or gets more upset, and then another person chips in, another person. So then it gets so loud and there's so much going on in there, rather than keeping it really quiet and using your one distractor and trying to just, kind of work through that way. So kind of thinking about that. Sometimes in those scenarios, we partner with the medical team too. And this is something you can do as a parent, to ask, can we have just one person talk? And so that not everyone's trying to reassure. You just have that one person that's the champion. Other things that you can think about too is, how do you adapt the senses around? We know that we experience all those different things can be trauma triggers from all the different senses. So how can you adapt your environment? Like, can you have special music or song or show on to make the environment, the medical environment, different? Do you bring peppermint oil or some other kind of smelling cookie or Doritos for some kids, whatever it works for your family and your child, so that they don't have to smell like, a certain medication smell or a certain medical environment. If you're going to be in the hospital for a while, many people decorate up their rooms, bring in their favorite things. So thinking about kind of each of the senses and what can you do to make your child feel more at home and more normalized. So a few other strategies, and again, you can probably find some great resources for these. If you can look up, if you Google like progressive muscle relaxation scripts for kids, there's somewhere that teaches you to kind of walk through progressive muscle relaxation. You can teach your kids that. You can do that with them. It can be a whole family activity about learning to relax their bodies and kind of relax their minds. If you do that, it can be really helpful to do it not during the intense moments, but to practice it when everybody's doing better, and then to try to use it as they get better at it in the harder moments. There's different kinds of diaphragmatic breathing. The one on here is called box breathing. So you kind of visualize and count as you go around the box and visualize the box. For the kids that we work with, we do all kinds of different kinds of diaphragmatic breathing. I have smell the cookie breathing, where you breathe in and you imagine you're smelling the cookie, and you breathe out and you're blowing on the cookie because you're getting ready to eat it. I've done Dorito breathing. I've done unicorn breathing. I've done butterfly breathing. I've done Minecraft breathing. So kind of anything that you can take that your child's interested in and kind of wrap a story around it to have them take those slow, deep breaths. It can be helpful to breathe out a little bit longer than you breathe in, as kind of a way to help calm your body. There's a lot of different visualization options too that you can add in. And there's a couple books that are in the resource section here that we can show too, that have some visualization things for kids. Okay, so just a quick note, I will not spend a ton of time on this. I know parents get kind of frustrated sometimes when we talk about self-care, but we know that for many medical journeys, it's not a sprint, it's a marathon. You got to keep going, keep doing it. So just thinking about, when you think about self-care, we don't mean necessarily that you have to take a week at the spa. If you can take a week at the spa and you want to take a week at the spa, I say go for it, take your week at the spa. But more what we're thinking about is what are the small things you can put in your day? Can you take a walk around the block? Can you call a friend? Can you bring a special magazine to read when you're at a really long medical appointment? Are your nutritional needs being met? Are you sleeping? Kind of all those different pieces of things, thinking through those things, and just kind of paying attention to yourself, assessing where you're at to make sure that you're caring for yourself. Maybe you get a self-care check-in buddy. So maybe you're not going to be able to make yourself take care of yourself. So maybe you have a friend that's like, hey, have you done your 5 breaths today that you promised yourself you were going to do? Did you do any journaling? So you have somebody kind of like an accountability partner as well. So thinking a little bit about when to get more help. So we always want to think about, a lot of the strategies we talked about today, and there's many more that you can learn over time of how to help your child, how to help yourself. But thinking about, when do I need to reach out to either my pediatrician, my medical team, maybe a psychologist, or mental health, another kind of mental health provider. If your emotions of your child are getting in the way of what they need to do, and you can't, your strategies, you've tried everything, it's just not working, that's a great time to reach out for some more help. If you just want more support for your child, if you feel like, well, we're doing kind of okay and I got this, but I think that my child could use a little bit more help. Sometimes we have parents reach out if they just want specific parenting strategies. And they're like, all right, I want to support my child the best I can, but I just need some more strategies. It's another great time to work out, reach out. It's getting late over here. Thinking about, of course, if there's any self-harm, if you're having self-harm thoughts yourself, if your child is having self-harm thoughts, if others are having self-harm or harm to other thoughts, or any of those actions, definitely get help right away. Those are the ones you go direct to your doctor, direct to the emergency room. Make sure that you can keep your child safe and yourself safe. The other one that I'll put in here for parents especially is if other people are concerned, because sometimes we're really good at shoving down our feelings as parents. But if other people are noticing and say, hey, maybe you want to get some help, that's another good reason to get some help. I would also just kind of put that out there that you don't have to do it on your own. There's no badges for doing it on your own. And sometimes it can be really helpful to come up with and find either a therapist or another kind of support to help you do it. So how do you reach out? So since COVID, we are having a mental health crisis. I think we talked about that earlier. Brandon shared that with us earlier in this talk. So it can be really hard to navigate the system. So people to turn to for help and guidance, your primary care provider for your child or yourself, child's pediatrician, your medical team. Sometimes you can go straight to mental health providers. Some families have shared with me, I just got this list from my insurance company. How do I figure it out? How do I pick? So the guidance that we usually give for that is, if you can find a mental health provider on that list that works with kids, if your child is a kid, that works with teens, if your child's a teenager. Ideally, they use evidence-based therapy, which means they're kind of up on the science about what is shown to work the best. It's great if you can find a medical provider that has experience with medical conditions. If you can't, you might need to provide some education to them about your child's medical condition. There's also some online platforms out there. School counselors can be a great resource. It kind of really depends on the school system. Some of them are fantastic and can even see kids in the school day. Some of them can provide referrals. Definitely use your emergency room for urgent safety concerns. And then I always like to give out the mental health crisis line 988. That's a nationwide number, similar to 911, but for mental health crisis, you can text or you can call. And so we always like to make sure everyone has that if they need more support urgently too. So I'm going to go through some resources, and again, we'll make these resources. You don't have to jot them down quickly. This is being recorded, so you'll have that. And then we also will make these resources list available as well for you all. I did talk a little bit about the Afraid of the Doctor book. And so that book is really written for parents to champion their child's healthcare. And so looking at, it's really short chapters. You can skip to sections that you want. You can read the whole thing through, kind of whatever works for you. We've embedded stories about different families and journeys that we've partnered with over time and how they kind of navigated having experience from medical traumatic stress. The Sully Coping Company has coping kits for a number of kids with different medical conditions. We have kits for siblings of kids with medical conditions, kids with cancer, sickle cell disease, food allergies, eosinophilic esophagitis, and injury currently. The cancer ones are available in Spanish and in English as well. And we are working on expanding. So check that out if that's something that you might be interested in. This is a little bit more information about the kits. So that each kit comes with a toy that's really to engage your child into the care. a book for caregivers. So there's really specific challenges that our families have shared with us are hard for them, with specific tips of like, what's your go-to tip? What can you try? And there's a deck of cards for kids so that there's really strategies that kids can pick out for themselves. Like, what do I want to try if I'm having trouble with any of those tips, for example? Some other books that I've really appreciated and enjoyed, and I don't think you need to be a mental health provider to use these books either. The Lori Light does some nice ones around relaxation. The Boy and the Turtle has some like kind of imagery in it. The octopus book there is the Angry Octopus is a progressive muscle relaxation story. So a lot of school age kids really respond well to these books. Another website that's made for parents called aftertheinjury.org. So this website is really, you can go and rate your child's reactions. You can get specific tips based on your child's reactions. It's a free resource for parents. And there's some video clips about parents talking about how they managed things with their child as well, and like what traumatic stress reactions might look like. This website has some materials for parents. So if this is called healthcaretoolbox.org, the mission of this kind of website is part of the Center for Pediatric Traumatic Stress is to help spread trauma-informed care kind of throughout healthcare places. So there's a lot of resources on here for healthcare professionals, but if you'll see, there's a tab there that's specific for families with some clicks for some free information there and handouts there. These are an example of a couple of the handouts that are available there, 8 ways that you can help your child cope at the hospital. And there's some different resources there that you can check out. There's also some links to additional resources on that page too. Alongside Network, which Jen is championed and founded. So again, she talked about that again. Definitely check out their website and take a look at the groups that they've been running also. And then there's some additional resources. A number of these are for siblings as well, and some kids with special needs and some chronic illnesses. You can take a look at those to see if those are ones that you might be interested for your family. These ones are more adult focused, and these are more about like mindfulness, calm, like, calming yourself down as a parent. Some of them are free, some of them have a charge. You can take a look at those if those are things you're interested in. And I think that brings us to the end. And I'm hoping that I think we have some time for some questions. If there's any in the chat, Brandon is going to share. And Jen and Brandon and I will try our best to come up with some answers for you all.
Absolutely. We did have one question in the chat that I caught, and I'm going to scroll through again. And if you'd like to ask any questions, please bring those to the chat now. The question is, how would you navigate or manage 2 children, different temperatures, of fit when they have 2 different trauma triggers? If each child, I'm gonna reword this because I think that they put some pieces in there. They're typing pretty quick. So how would you navigate and manage 2 different children with 2 different temperaments, and figure out what their fits are if they both have 2 different triggers and they can trigger each other at times?
Oh my goodness, siblings. I love them, and they're so challenging. So just in general, I think when we think about kids and their triggers, I think whoever wrote that question, so many props to you for recognizing that different kids have different triggers, and for also recognizing that what might be happening between the siblings at times are potential trauma triggers. And so I think in general, one of the things that we sometimes work with kids and families about is kind of educating kids too on what are the things that are hard for you? What are the things that are making you feel anxious or worried or bringing up those feelings in you? And then working with each child probably individually if the triggers are different. Depending on the kids and the family and kind of how they get along, there might be an opportunity to bring your family together to say, oh, look, like you're having the same reactions, but for different reasons or different things, and hopefully partnering together so that you try not to trigger each other. Sometimes kids love to find the worst triggers they can for their siblings and go for it. So that also is something to work with. I think if you're having a lot of trouble with it, working with a mental health provider directly could be really helpful because they could help give like tailored strategies for you and your family to kind of work through. Brandon or Jen, do you have other ideas around that?
I think your suggestions are really great, Megan. And I just have to say, before we dive into more questions, Megan, you weren't probably able to see the chat, but I think everyone is just very much appreciating all the information that you're sharing. And I have to say, from the family perspective, so much of what you talked about really echoes the experiences of families that we work with, and just really appreciate all the information that you shared. Thank you.
Oh, that's wonderful. It is really hard to not, because I can't read the chat and talk at the same time for sure. I'm
Yeah.
not that skilled. So it is really hard to know, what's going on out there. So that's
Yeah.
wonderful. Thank you, Jen. I'm glad that folks are finding it helpful.
Absolutely. A few more questions are rolling on in. The next question is, are there any specific evidence-based mental health practices or modalities that have been shown to work best for chronic medical trauma?
So the short answer is we need a lot more research to kind of confirm and kind of prove what we think is most likely to work. I think in practice, mostly what people are doing these days, who have trauma expertise and chronic illness expertise, are applying some of the principles of trauma-focused CBT, cognitive behavioral therapy, or components of cognitive behavioral therapy, because that has one of the strongest evidence bases in kids for trauma symptoms and other kind of mental health symptoms. We definitely, as a field, are hoping that we'll kind of continue to research to confirm and see, are there things we need to adapt? I think probably what happens now is clinicians who know chronic medical care adapt themselves, but there's not like a beautiful protocolized treatment that is ready to go. There are some for pain. There's some pain focused chronic pain one, and that's a CBT based, like pain focused CBT, but not specifically for medical stress yet.
And similarly
also-
for caregivers and parents, that a similar body of research still needs to be further developed, but also exists to some extent around CBT, and then also around ACT, so acceptance commitment therapy. There are some really great interventions for parents and caregivers that rely on ACT. So.
And we also have folks who are also sharing resources and answering questions in the chat, which is amazing.
Wonderful.
Shout out to Kate, who said child parent psychotherapy can be helpful to process trauma didactically as well.
Yeah, I do think, especially if you're working with younger children, and sometimes with teens, bringing parents and children together, I would say is ideal and probably best practice at this time. That you might work some individually with children and on strategies, but you're going to want to partner with parents and families to reinforce those strategies. And then sometimes there are strategies that providers might suggest parents work on for themselves so that they're not kind of transmitting some of their own anxiety. Kids are really smart. So I will say, I'll put this other plug in for taking care of yourself. A lot of times as adults, we think that parents, or we think that we can hide our feelings from our kids. Our kids, like, we know our kids and they know us. And so I will say, if you're struggling, think about taking care of yourself in that way also for your child.
Perfect. The next question is, do you have any ideas for helping my child during her extended hospital stays? And I would extend that question and say, also, do you have any tips to assist families who are also dealing with hospitalization of their young child?
Jen, do you want to start with that? And then you've had some experiences, I think, and with your network and everything.
Yeah, I think absolutely. I mean, part of what we want to think about, so not only the hospital stay, one thing that we really emphasize is that the hospital stay is such a acute part of the intervention or of the experience. And we really want to extend that arc of the experience to further out, so that we're thinking about, when families come home, suddenly they're dealing with being the caregiver. They've got siblings who may have come back into the home, who may have been doing something else. They're suddenly administering all the medications. They're sort of on a 24-hour schedule where they may have had 9 people in the room throughout the day in the hospital, and they had a cafeteria to rely on. Suddenly they have all of these needs within the household. So just also want to draw attention to the need of families and how much that extends beyond the hospital stay. And of course, when you're in the hospital, there are great ways for our larger support networks to be part of that experience. So Caring Bridge is, of course, a site that we really love. Meal trains. So even when people are in the hospital, it can be really nice to have a 2-minute visit from someone who drops off dinner and just makes you feel a little bit loved in that 2-minute exchange. Definitely getting outside every day. Like, there are just small pieces that feel so important. So even if it just means going around the block for 15 minutes, taking a little bit of space for yourself is so hard when you have a child that feels like every minute is very tentative. And we know that without sustaining yourself through some of that experience, ultimately it's less good for your child, right? So when you are totally depleted by the time you come home, and then the expectation is that you're going to take over all of these different roles, that can be extremely challenging. So just really encourage folks to do as much sort of self-preservation as you can do while you're in the hospital. And yeah, that means trying to eat well, trying to communicate with the outside world as much as possible, trying to get some fresh air, even for just 10 or 15 minutes a day, trying to leave the room. If there is a Ronald McDonald House, sleeping there rather than sleeping in the room, if that's possible, so that you can get, even if it's every other night, get a good night's sleep, which is a challenge anyway, but just really making sure that you sustain some of yourself in that experience, which I know is, I would have said no to in so many ways. And we just know, like, that is just so important for families to be able to sustain the experience. And Megan, do you want to add to that?
Yeah, just a couple of things come to mind too, thinking about like ideas that sometimes have helped some of our families. So trying to keep your child engaged in whatever creative way you can. So if that's zooming in to cheerleading practice, even like having a friend, put them up so that they can watch practice, or if it's if your family eats dinner together every night, have somebody at home with, electronic yourself into that. Keeping things as much on schedule as possible. That can be really hard in the hospital, but if you have like a bedtime routine with your child at home, like you might have to modify it up and mock it up. But if you brush your teeth, get clean and like read a story and snuggle in, like following kind of that same pattern to try to like keep their bodies going, and similarly as to at home. Sometimes it works better than others. Other things that sometimes help families, especially for younger kids, if there's siblings at both places, having like either like a shared like stuffed animal, so that one has the same stuffed animal at the hospital and the other one has that same stuffed animal at home, to kind of make that connection, or a soft blanket that kind of match or coordinate. That can be helpful kind of for siblings on both ends. Utilizing whatever the hospital has there. If it's a long hospitalization, if you can go to a playroom, if you're allowed to walk around the hospital, if you're not allowed to leave the room, what can you bring in? What do you have, a special art project or a special Lego project or something that you do only at the hospital? So trying to think about, what are ways to kind of keep your child entertained. It can be, those hospital stays can be real boring. If your child is feeling good enough, they can be really boring. If they're not feeling good enough, then, there's other challenges along that way. So those are some ideas that come to mind as well.
Perfect. The next question is, what are some recommendations for working with our children's medical care providers?
So I think like really depends on your medical team, so I'll just say common challenges I hear are like communication around medical team members. So if your child's in the hospital, sometimes it can be helpful to put questions and answers and have your docs write the answers right on the whiteboard. So if there's a whiteboard in the room, or get a giant piece of paper and have them write the answers right on there. So when the next team comes in, you can point to and say, well, actually that doc said this, like, is that what you're saying? Because you are often tasked with that job of managing your child's medical care. Some families have like created a binder and, print things out, or have a journal or notebook so that they can open it up every time a provider comes in. That way they can kind of reorient. I do think There's some times where you absolutely probably everyone deserves to be very angry at medical teams at times. But I think at times when that's not the case, showing some appreciation. I think a lot of our medical teams, I can speak on the other end of that. A lot of our medical providers have put in a lot of hours. The teams that I work with care about the kids so much. And you might come across a team that doesn't. But in my experience, even if you're seeing it or it doesn't seem like they care, that's often not in the back end what's happening. So giving them some grace as well. Of course, they need to be on top of your child's care. Of course, they need to not make mistakes. Absolutely. And I'm all on board with that. But also, showing appreciation when you can, like a note that just says, thanks for talking to us yesterday. I mean, just like something really simple. I mean, some of those medical providers, they would carry that with them and put it in a binder, and like, it makes a big difference. So both like thinking about, how do you partner with them? You don't need to be like buying them gifts or anything, but like just showing a little bit of like, we appreciate that you're on this journey with us, with our child, but also absolutely asking the questions you need to ask. If you don't get the answer you need, asking again, not feeling bad about that. Don't feel bad. Like, I forgot the answer, I need to ask again, like advocating as well. So kind of that balance can be tricky, but those are a few ideas. Jen, do you have other ideas from your experiences?
No, I think those are great suggestions. Yeah. Those are great ideas.
All right. There are a few more. The next question is, can you comment on the outcome difference when a trauma is addressed at the time it occurs versus years down the road when it impact grows and elicits a professional intervention?
Oh, I am so pro prevention. Like, that is my whole world of what I'm trying to do to change our system. Like, let's prevent as much as we can, or address it early on. I think if we can, we address it early. If we can catch medical traumatic stress reactions. So if we see it in our kids early, we see it in ourselves early, it's kind of easier to address things kind of the earlier we find them in general. But that's not to say that even if you start to address them when they're really, really bad, like, there's still hope. There's still really good treatments out there. You can still change your trajectory even down the road. So ideally, of course, we're going to want to address them as soon as we can. But even if for whatever reason that doesn't happen, that doesn't mean it's hopeless. There's still like room for treatment and room for growth and help.
Yeah, that's very helpful, Megan. I think I can speak from my experience having had a delayed intervention. Like I said, so our son was 7 months old when he had this major medical trauma. And then we really didn't find the right support for him till he was 7 years old. And I can tie this in. Someone asked if I'd be willing to share things that worked. So early on in our experience, we really couldn't find a therapist who was able to sort of say, here's what happened, here's what that means, here's what it's called, here's what we do about it. And instead, really ran up against a lot of invalidation. Like, maybe this is your parenting. Are you too jumpy now? Folks sort of blaming us for what was happening with him and really sort of turning the lens back on the caregiver. And I think a lot of families experience that.
Yeah.
Really sort of
Yeah.
feeling like, I don't think this is me. Like, it feels quite different. And I think we're coming at it in a similar way. So I think a big part of what's very, very helpful for families is just that validation, just saying, here's what this is. And I saw a webinar about it, or I know a couple of resources I can point you to. I think about families who come to our groups and the way that we sort of take the pressure out of the room so quickly to be able to say, oh yeah, here's what this is, like, here's the data and the research behind it. It's amazing what that means for families who are sort of sitting isolated at home and knowing something is really different about my kid, and everyone keeps telling me that that's not true. And I know that something is really different. So, we did play therapy, we did attachment therapy, like, we did a whole bunch of different things that were not the right thing. And it wasn't until we really found a therapist who was able to say, like, here's what happened in his brain, here's what that means for us, like, here's what we can do going forward. And he had significant mental health challenges throughout that time. And when we were able to get the right intervention, he's now a thriving 6th grader. Like, it's as Megan said, like it's not hopeless. It's just really finding the right supports is the key, no matter when that happens. But certainly early intervention is so important if that's possible.
Speaking to something that Jen just mentioned there, I have this moment, like this was like, goodness, maybe 10 or more years ago now, but where we were actually doing research on the Celly coping kit and with a caregiver guide. And I remember sitting with this mom and showing her because we were asking like, what are we missing? What is this like for your family? Like, how do we make this better? And she read it and she just looked up and said, I thought we were the only ones. And it was like this key moment for me as like, wanting to make a difference of being like, oh, we have to do better and like get this information out there that, so many people experience this. You are not crazy. You are not alone. This is real. Like kind of, and I will say, I definitely have had many, many experiences where people land in my office and they're like, no one believes me. They didn't believe me. I'm like, no, yeah, I know. I get it. But it, we need to work to shift our systems that way.
Mhm.
Oh, can't hear you, Brandon. I think you're muted.
I was just saying we're gonna run out of time and we have some really good questions. I want to try to squeeze two questions together. Um, let's reverse it a little bit. What are there any tips that you all have for children who end up having parents with chronic illness? And are there any tips for partners who have their other partner may have a chronic illness and they share children together? How can they also be supportive in that household dynamic?
So I do get that question quite a bit actually because of this work in this space. I'm not as up on all of those resources, but there are a lot of books out there around like books for kids of parents with chronic diseases or chronic illnesses. I don't know, Jen, if you know any of them off the top of your head, but I think again, kind of going back to one of the things that Jen said, and kind of part of what this talk is about is like recognizing what it is, communicating about it, sharing about it, and not judging each other. So kind of at the baseline of like, oh, I see what this is. I understand why you're reacting that way. And then figuring out if you need support as a family in any of those spaces and advocating for that support until you get what you need.
Perfect. Any final words, Jen or Dr. Marsac? Any final thoughts as we close out this evening?
I see a question about mental health providers. So the Center for Pediatric Traumatic Stress has a list of mental health providers across the country who have self identified as folks who have an interest in medical traumatic stress. And so we have access to that. I'm sure Dr. Marsac too. So that this is a great resource for folks who are looking for someone specific who has an interest in that space. And yeah, I guess my only closing other thought is just thank you all so much for being here. I just think about sort of the ripples coming out from this and the work that you all do, validating families, referring them to resources. And if there are, families on here who now have access to resources that you may not have known about, just so happy to have so many folks on tonight. Thank you.
Thanks so much. Appreciate it, everyone.
All right, everyone, take care. This is recorded. We will send it out to all that registered with a handout. Thank you all for joining us this evening. Right.